Good day, everybody. I'm Gretchen Minnar, and I'm the Services Manager at the Cancer Association of South Africa. And today we are going to focus on men and cancer, and specifically breast cancer. In October, we focus a lot on breast cancer and cervical cancer for the ladies. So it's only fitting that we also focus on men, and today we are going to speak about men and breast cancer. And with me, I have a special colleague and survivor, Bobby Weir, who is going to introduce himself.
Hi, everyone, and thank you for this opportunity. Yes, I am a male breast cancer survivor in my 50s. I think I was 55. I felt a pea-sized lump next to my nipple on my right chest. And jokingly, I said to my wife, oh, I've got breast cancer, as a joke, because it wasn't painful. It was just this little arbitrary lump that appeared. And because it wasn't painful, I left it. And, because I was convinced that men don't get breast cancer or anything like that, I didn't bother with it. And it grew and grew, not painfully. And I remember at a point I mentioned to a friend of mine that I had this lump next to my nipple, and he said to me, it's probably just a sweat gland that's got a bit blocked, and maybe when I bath again, I must use a bit of Epsom salts and salt and, give it a good rub, which I did. And it didn't do anything. It carried on growing. My wife, on the other hand, was very concerned, and she really wanted me to go and see the doctor, and I just kept putting it off because I was convinced that men don't have this issue. But it's not true. I was actually very, very fortunate in that I met people here in town, or a person who had just been diagnosed and was going through treatment. So when I eventually got to the doctor and they said to me, that is cancer, I was very annoyed because, first of all, she didn't check, she didn't, draw blood or have x-rays done. And then I realized afterwards that just by looking at my breast, it was blatantly obvious. We talk about that orange peel skin. I had it. The inverted nipple, I had it. All that stuff. And it wasn't painful. And this is, I think, what is a serious problem for us, is that it's not painful, and so we ignore it. And anyway.
Sorry to interrupt you, Bobby. I wanted to ask you, so the lump, the inverted nipple, the orange peel skin, that is all warning signs for breast cancer. And I assume you worked at cancer at that stage. Did you link that to breast cancer? Did you see it as warning signs?
Not at all. In fact, I was still doing landscaping and gardening at the time. And yes, I wasn't working for cancer. I didn't realize that these were signs. And, we don't talk about our bodies as men, generally. So it was just kept quiet. And as I say, my wife kept on and on and on. And so, I went to the doctor, and it was the 28th of December, I won't forget. And that I got that news that you have cancer. I still didn't believe it because, it's just something that men don't get. And then after surgery and all that, I realized that it was cancer. I just accepted it. And you know what? The public in general are so ignorant. The oncologist, not the oncologist, the surgeon who did the operation, he said to me that you will need to go for chemo. And I was under the impression, well, it's just pills that I can take, And I went into the oncologist's office and I said to him, let's get this thing over and done with. You give me the pills that I need, and I'll take them as and when needed. and we'll get over this. But it wasn't. It wasn't that at all. In fact, before that, now I'm just stressing this because it's something that hit me hard between the eyes. When we came back from my operation, I'd had the mastectomy, and we were sitting at home, and my wife's family came from Witbank to visit. And we were chatting, and during conversation, it came out that my sisters were going to come up to Polokwane to meet me. Well, not to meet me, but just to spend time with me. And I said to my wife after they'd gone, I said, you guys know I'm dying, but none of you have got the guts to tell me. And she said to me, I need the support more than you need it, because I don't know how to handle it. And it was something that I've never forgotten. We so underestimate the caregiver in times like this. And we've got cancer, we're going with the flow. But our caregivers do not know, and they don't know how to handle it.
Bobby, I also want to add, and at CANSA we acknowledge and we recognize the role that the caregivers play, and that they also need a space where they can share and get support. And we do have a WhatsApp support group for caregivers where they can support each other. Also, I want to ask you, Bobby, so your wife was part of your journey from the beginning. She was the one who motivated you to go to the doctor to find out what is this warning signs and is it cancer. And your family was so supportive in your journey, Bobby. How did you share the news of a cancer diagnosis to your family? Do you think it's different for males, especially a male with breast cancer? Was that difficult for you to do, Bobby?
You know what? My dad died of cancer when I was very young. He had lung cancer. He was a heavy smoker. So for me to break the news to my mom, it was a bit of a rough pull for both of us. But she just said to me, I'm here. We're going to go through this. My wife, Linda, is an absolute star, an absolute awesome woman. And she was the one that made sure that I had enough to drink. You don't want to eat. You don't want to do things. And she was the one that would say, now, come, here's just something small. Instead of a large plate of food, small little servings on a side plate. Just trying to make it as appetizing as possible. And again, it was only because she was able to tap into resources from other people who would say to her, listen, try this and try that. Because for a guy, somehow I won't say we have this mental block, but it's almost, this doesn't happen to guys. This doesn't happen to us. As I say, I was very lucky. One of the vets in town was just coming through, was just finishing chemo. And we got chatting, and he told me it's mind games of a serious order. You've got to keep your mind right. And that helped a lot as well, being positive about things.
Yeah, that is so true, Bobby. And you spoke a little bit of chemotherapy. Before I go to chemotherapy, I just want to say when patients with cancer don't have anywhere to turn to, they can turn to CANSA because we do have telecounseling, which is a telephonic professional counseling service offering that we have available in 7 languages. That is also so important because when you're in pain and when you are distressed, you want to communicate in your own language. We know that some cancer patients stay on their own, they don't have family members around, and we also have clinical counseling because you spoke a little bit about chemotherapy, Bobby. You didn't know what chemotherapy was, so I assume there was no explanation from the doctor. So how did you experience your treatment, Bobby?
Gretchen, you've just mentioned something very important. You know, we blame the doctors. They didn't tell us blah, blah. That's not true. The doctors actually explain so much, but we don't listen. We don't hear. We listen without hearing, if I can put it like that. And fortunately, I was in a position where my wife went with me to every doctor's visit, every oncologic visit, everything. And she made notes of what was being said. And so, you know, when I said to her, well, they never told me that I can't take a pill, she said, yes, they did. They said this and that. When I have this absolute fear of needles. So we had a port put in for me. And again, we were in a very fortunate position because we had medical aid, which covered the oncology. But there are so many people who really have these phobias, and we need to sit down and just chat with them and say, you know what, the more you relax, the easier it is. Because working with the kids as well, I see how they scream and they get this absolute, it's a phobia that gets built into them. And you need to just pull them aside and say, listen, as a sucker, let's talk about this sort of thing. The chemo, you know, your body also builds up a mental thing. The day you know that you've got to go for chemo, I have a wonderful wife, but on a chemo morning, when she would wake me up, I would be so the hell in with her. There isn't another word for it. And it's not as though I was annoyed with Linda or anything, but it's my body was knowing what's coming, is the only way that I can explain it. And yeah, it's not fun. And you know, you look at yourself in the mirror as well, and you think, well, I'm actually half a man. I'm not a full man anymore. Not that anything on your manhood has been touched, but your chest is now no longer that big chest, you know, the macho image. And that plays also an important role in how I accepted myself.
And that's, I want to add on what you just said, Bobby. Also, as a counselor, we know that with cancer disease, there are so many losses, and we continuously encourage the patients to take control of this journey. And the first step of taking control is asking the doctors questions, and especially the public hospital patients. If your doctor is not communicating with you, take the control and ask the questions and take control of this journey. And I don't like the word journey because when we refer to a journey, it's most of the time something that we look forward to. And now we speak of a cancer journey, and we know that this cancer journey is full of ups and downs, Bobby. I want to ask you, what was the most difficult part of your cancer journey?
There were several. Losing my hair was bad news. And I've seen it in the ward with kids. I've seen it with so many people that I've spoken to subsequently. Losing your hair, your loss of appetite, you just feel terrible. Everything smells and tastes terrible. But you work around it. You try some. Don't go with big meals. Go with something small. Your body will tell you, I need something sweet, I need something salty. Listen to your body. And you know, you mentioned the public hospitals, and it's very true. And one of the good things about CANSA is we have an advocacy department that really stands in the gap. I know for a fact that the advocacy department also goes to the hospitals and chats with the doctors about these patients. And, you know, once you've just sat down and said to them, listen, doctor says A, B, C, and D, they start remembering, oh, yes, but he did say something like that and what have you. And what it is, basically, you stand aside and just catch a breath of air and then go on again. And yes, it is a journey and it's your decision. Am I going to make the most of it or am I going to hate it? And for me, at the time, it was terrible. It was a year in my life that was wasted. But looking back, it was actually the best year in my life. I was extremely blessed with support from family, support from people that I never thought would support. You lose a lot of your friends because they don't know how to handle you. They don't know what to say. That saying, keep strong, keep fighting. Meanwhile, you're doing just that. That's all you can do. So they stop coming around, and these things are very real. You feel rejected, but actually you make a lot of new, lasting friends.
Bobby, thank you for sharing that and for your honesty. And it's so true that sometimes people and family members, neighbors stay away, not because they want to, but because they don't know what to say, or they're looking for the right words to say. And then the cancer patient might feel deserted. Um, we also have all these other wonderful service offerings, Bobby. You spoke about loss of hair, and we do have wig banks at the cancer care centers. I was just wondering, did you ever consider um, to request a wig, or was that not something that you opted for?
No, I didn't. I didn't wear a wig. You know, from landscaping days, you more or less always have a hat on. So I could get away with it with just wearing a hat. Um, and yeah, it's one of those things I've seen with the children, and most of them are African, and being cheeskop is considered pretty much the norm, and yet there are some of them that really, when you bring in some of these play wigs, false wigs, things like that, they love it. They love the hair. So yeah, your appearance, what you look like to the man in the street, really means a lot to a lot of people. And although I wouldn't consider wearing a wig, um, I know that there are people that have spoken, and I've been in the very fortunate position because having gone through breast cancer, um, having had almost a mentor that went through before me, in town, I have subsequently come across 4 men with breast cancer. And there was one man who had a hairpiece, and he used to keep his hairpiece on. He had a cap on top of that, but there was a little bit of hair that was sticking out from under the cap, and he said that was his normality during this time. But yeah, it's a real fact. But you know what? It's not just your hair, and it's not just your appetite. Um, it's you almost lose your zest for life. I don't know what the word is, but you know what I'm saying.
Yeah.
Everything's too much of an effort, and you've got to, we daren't start taking it slow then because I don't feel like or whatever. Muscles not used or muscles lost. You know what I'm saying? So you've got to try and work with your things. Do what you can. You're not a cabbage. One of the things that happened with me was I got lymphedema because, again, being the man, you get told to do the spider walk, which is very simple. Stand next to a wall and with your 2 fingers run up the wall as far as you can and back down and, up and down. And I did this once or twice and I said, but this is useless. What are you trying to achieve by this simple little thing? And as a result, one arm is bigger than the other because of lymphedema. But it's something that could have been avoided. But men, we must stop being so pig-headed, actually, and do the little things that seem so unimportant.
Yeah, and Bobby, I hear what you are saying, and also we see that the men are less likely to seek emotional support. We see that from our stats that 87% of our beneficiaries are women, and men only accounts for the other 13%. So I know that you are also one of the founders and committee members, Bobby, of our men's support group, and we are so privileged to have you as part of that committee because you are a cancer staff member and you are a survivor. And that WhatsApp support group is so important because men also need a space and a holding space. And whatever that space might be, like you say, for some losing their hair might be it's more of a loss than for others. Like you wore a hat and that didn't matter that much for you. All of us are different. Um, Bobby, but if you can give a message to men, what you have learned from your experience, because we know that the way you were raised is the way that you will tackle challenges in life. And boys are we groom them and we raise them with you have to be the strong one. And now you
Yes.
are the breadwinner, you are the man in the house, and you got breast cancer. What would be your message, your learning experience that you take away from your cancer journey, and Bobby, that you want to give to your fellow travelers?
You know what? As men, or for me, I don't believe in sharing my emotions, which is wrong, because I mean we've got our wives, our partners, and it's for better or for worse. And so many times, Linda said to me, "Just tell me what you're feeling. Just tell me what are you thinking." And I'd say, "No, I'm fine. I'm fine. Everything is fine." I was running my own business. I still am, and you kind of like feel you can't handle. You're too tired for the nitty gritties. Which are important to other people. But you know what? We don't have to do this alone. And that is the big thing, guys. We don't have to do it alone. There's help out there waiting and wanting to be given. Take it. Um, we as men, I do a lot of talks and I challenge the guys to be the man in the house and to start with self examination and to teach your kids self examination. You know, the ignorance that's out there is horrible. Um, and my serious message is be your own CEO, as someone said, and take command of your body. You check it, and then you can expect others to check theirs. And anything that is not normal, follow it up. It's not cancer, but you've taken ownership and you follow it up. And teach your kids to do the same. Um, Seriously, there's so much cancer out there, and it's just on the increase. And there's so much heartache that can be solved just by taking charge.
Thank you, Bobby, for that important message. I like what you said, be the CEO of your own life, take control, do that self-examinations. Thank you for your time, Bobby. Um, you are such a inspiration to all of us, and your light really shines through as a cancer survivor. Also to your wife, thank you for the pivotal part that she played, Bobby, as a caregiver. And then I want to encourage everybody, if you need more information, whether it's clinical, if you are seeking emotional support, please contact our cancer help desk. I want to share the number. That is 0800 22 66 22. I'm going to repeat that, 0800 22 66 22. Thank you for your time, Bobby.
Just one last word. You know what, guys, the information is there. This little journey through cancer takes many ups and downs. The information is there. Thank you, Gretchen. I appreciate the opportunity.
Our guest for today is Dr. Michele. He's a trained medical doctor. He's based in Cape Town and he was diagnosed with testicular cancer just before COVID. He has a very interesting Instagram handle, Grabbed by the Balls, and this is his efforts to educate and share his story with others. Dr. Michele, I'm handing over to you to introduce yourself.
Okay, so who I am, I'm Michele Vanzaghi. I probably introduce myself as, I'm a medical doctor, and I'm a young male living in Cape Town. And I guess at this point, I can call myself a testicular cancer survivor. I was diagnosed with stage 1, mixed germ cell testicular cancer about 4 years ago, and I am currently pretty much in full remission under surveillance. And that's who I am. So getting diagnosed with cancer, or how did I get diagnosed? I think that's probably something that people are fear, or one of the greatest fears people have in their lives is to get the bad news that you have been diagnosed with cancer. And there's a lot of stigma around the word cancer. So I was in my second year of medical internship. We complete medical school and then we have a compulsory 2-year internship in South Africa where we work in a hospital, usually a peripheral hospital. So I was working in Pietermaritzburg doing my medical internship. And in terms of symptoms, I always tell people I was completely asymptomatic, but I did feel a lump. So my symptom was a small lump growing on my left testicle. I wouldn't say it felt malicious in any way. It wasn't painful. It wasn't sort of eroding through the scrotal wall, anything like that. It was just a small lump that was kind of perched on the one pole of the testicle. And I also had a little bit of backache, but to be honest, I was very well and healthy. I was training to do a triathlon at that point. So I didn't have any sort of conventional cancer symptoms. I wasn't fatigued and malaise. I wasn't losing weight. The only thing that I had was a little bit of lower back pain, but that was really the only symptom that I had. And yeah, I felt a lump on the left testicle. And I really highlight this in terms of, presenting early. If I wasn't a doctor and I hadn't studied about testicular cancer and how the disease presents in young men between the ages of sort of 18 and 35, where I was 24, so I was at the perfect age, and not just living in denial and ignoring these small symptoms that most of the time, 95% of the time, are nothing serious, and they can just be a cyst or something non-sinister. And that's the reality of my situation. I was a young, healthy man, busy with my medical internship, and I had this lump, and that's basically, what happened. And I presented to a urologist who did a non-invasive ultrasound test that kind of confirms the diagnosis of cancer. And shortly thereafter, I had an operation to take out the testicle, and I also did a course of chemotherapy. So chemo, and what does chemo mean? What is chemo? Chemotherapy is an intravenous or an oral medication that's usually used against certain forms of cancer, and there's a massive variety or versatility in that term. There can be different durations of treatment, there can be different forms of administration. I got intravenous chemotherapy for a course of 6 months, but I didn't go every single day. So I would do 5 days of treatment for about 6 to 8 hours a day. And then I would take a 2-week break. So I would do 5 days on and then 2 weeks off, and then 5 days on and 2 weeks off for the duration of 6 months. And the reason we do it like that is to give the body a little bit of time to recover from that pretty harsh treatment. I did my treatment in a beautiful clinic. So, we sit on a recliner and you get an intravenous drip put in, and then the chemotherapy is administered. And that process is tough because, chemo really breaks down all the cells in your body in order to kill the cancer cells. So you lose your hair, you become extremely nauseous, you lose a lot of weight, and you lose a lot of energy. And for me, it was really that energy loss that was very difficult to deal with. But if you have a community and you have people around you and people to talk to, that process becomes a lot easier. And when you realize that you're not alone, you have support structures in your path, and you have people to share and bounce ideas off of in terms of how to manage and deal with this time, it becomes a lot easier. So yeah, I think that I can say that my family and my mother in particular were cornerstones of me getting through that treatment. And my community, my friends who spoke to me on a daily basis and just encouraged me to stay positive, that was a cornerstone of getting through chemotherapy. So sharing a cancer diagnosis with your family is a particularly scary thing. I always say that, getting diagnosed yourself, you kind of go immediately into survival mode, or at least I did. And what was really interesting to me was that I think I learned a lot from sharing that news with my family. I don't think as a young person you really appreciate and acknowledge how much your family cares for you, especially if you're lucky like me to have a very close-knit family. But you will never understand love and care until you see that kind of appreciation for you. So yeah, it's a difficult thing to do, and you do feel guilt in a certain degree because you are now kind of at the expense of other people. You can't really, take all the care that you need to of yourself, and you now have you're putting this burden onto other people. So there's a lot of things that go through your mind when you need to tell your family that you've been diagnosed with cancer. But the reality is that they are the cornerstone of your survival and you coming out of this thing positively and healthily. And that is what family is about. So I think that was a huge thing for me to understand and to work through. And yeah, just to be open in terms of your communication with them. Don't hide things. There's no stigma attached to this. This is not anybody's fault, and I think that we need to really highlight that. It was interesting. My mother would often say she feels guilty. I did nothing to deserve this. I don't have any risk factors. My lifestyle is perfect. I haven't really done anything that would put me at risk of developing cancer, and therefore it's a genetic mutation that is what led to this diagnosis. So people often like to attach guilt to something, but I think having constant conversations with people and making everybody aware that this is nobody's fault was really important in my process. So I think very interestingly, many people asked me this question. One was girlfriend and one was just friends, and how those people reacted to a cancer diagnosis. When I told them that I had a suspicion and that I'm going to the urologist, I didn't hide that. I made that openly clear. I was like, I have a lump, but they're all medical people. They're all doctors. So, I think that if you're a guy in a group of friends, there's a lot of anxiety around admitting that you're going to see a urologist for a testicular problem, which is not really warranted, but it is the reality. Men in general, much more than women, don't like to talk about, genital exams and testicular problems. And, any urinary system problem kind of just gets left under the weather. But I was lucky enough to have made that pretty open. And, they were not suspecting that this would be the outcome. And when I told them, there was obviously an element of shock, and everybody was very surprised by the diagnosis because I wasn't a sick person. But it's incredible how you feel like your friends will turn away from you, but they honestly were incredible. They all gave me incredible support, and I can't highlight enough about how being open and honest about what's happening and telling them what you're going through and really expressing what's difficult for you will help them to guide you through that process. If you feel guilty for telling people, I'm really struggling with fatigue or nausea, they will support you, and you need to remember that that's what your friends are there for. They will support you through that time. And then obviously the girlfriend thing, there's a big stigma attached to, if you have an orchidectomy, which is the removal of the testicle, that you become infertile, or that you're going to lose testosterone and lose your sex drive and lose all of those things. It's absolutely not true. So those are common misperceptions in people. You're having one testicle leaves you with exactly the same testosterone count as any other man. You can function completely normally in terms of your fertility, your ability to work out, to exercise, to build muscle mass. All of those things are exactly the same. So it doesn't change you as a person. It doesn't change your masculinity. It's purely just an operation. Like removing a kidney, you can still function completely normally. You don't have to think that your wife or your girlfriend is going to run away from you if you go through a diagnosis like this. And those people that really care for you and love for you will always support you, and they will stand by you. And you need to remember that, and remember that you deserve that. So my message in terms of what I would like to tell people about, my journey is that I think at this point in my life, I'm a good example that there's absolutely life after a diagnosis. And what I always say to everybody is that don't live in denial. Don't live in the fear of getting diagnosed and not do anything about a concern that you have. Your intuition and your gut are very important. And most of the time, by presenting to a doctor about a concern, you're going to get news that's going to be good. That's going to confirm that this is nothing serious. And if it is bad news, as in my case, the reality is that is still better than living with that fear of this being something bad. And the reality is that early presentation saves lives. Early screening, early detection for all cancers always has a better outcome than leaving them undiagnosed because of the fear of getting the diagnosis. And in my case, I just go to show, testicular cancer is a very rapidly progressive, very aggressive type of cancer if it's left undiagnosed. If you remove the testicle and you do chemotherapy like me, just to make 100% sure that the cancer is removed from your body, then your chance of full remission and a normal life thereafter is way higher than leaving it for, say, 3 to 4 years, and then the disease spreading and you having to go through much longer duration of treatment and run the way higher risk of a relapse into the disease again. So my real message is just don't live in fear. If something is bothering you, be proactive and do something about it. And please take all the measures for early screening, in terms of regular self-examinations, in terms of men doing testicular examinations, women doing breast examinations, and for slightly older men going for your prostate exams. Those are really important parts of human beings and the healthcare system.
Thank you to our two guests, Dr. Michele and Bobby Ware, a cancer staff member, for joining us today. I really hope that the listeners will learn something from your experiences or take away something from your experiences. And then I just want to remind everybody to access our cancer website. It's user-friendly, www.cancer.org.za. If you need any information or more information on our services, you can access our website. Thank you.